Dr.
He was
Chirag?
absent.
Oh,
He was absent at that time.
you were absent actually.
He was absent at that time. I have written the absent.
He's
You
coming.
just have
Okay.
tossed it out and then
Okay.
you can. Please start your presentation. Okay. He'll be talking on subclinical central macular thickness and total macular volume with SDOCT and its correlation with HbA1c. It's not starting.
No, this is not.
Kim.
No, this is not my topic.
Just click there.
Okay, good afternoon. There's no financial interest or any conflict of interest with this study. So coming to introduction, diabetic mellitus stands out as a prevalent microangiopathy exerting a multifaceted impact on various organs. Among these complications, diabetic retinopathy is a common microvascular complication. Glycosylated hemoglobin is a crucial marker for long-term glycemic control. Uncontrolled HbA1c levels have been associated with DR characterized by macular edema, neovascular hemorrhages, and ischemia. DME is a major cause of visual loss in diabetes. And a large body of research has linked the frequency of clinically diagnosed DME to the intensity of DR. Nevertheless, there is a lack of data on how often a subclinical DME occurs and how severe retinopathy is. OCT is more sensitive than clinical examination alone in detecting subclinical diabetic macular edema, and proving the existence of a preclinical stage of this maculopathy would be very helpful in alerting diabetics to the need for better glycemic management and offering them early warning indications. So the objective of a study is to evaluate differences in central macular thickness and total macular volume between diabetic patients without diabetic retinopathy and non-diabetic individuals, and to establish connection between CMT, TMV, and HbA1c levels. Material method. It's a cross-sectional analytical study conducted in Al-Jalwa Hospital in rural Karnataka, India. Participants included diabetic patients without diabetic retinopathy and non-diabetic controls. So our inclusion criteria included patients who are more than 40 years of age, where cases are those who are clinically diagnosed diabetic mellitus for more than 10 years, either type 1 or type 2, without any evidence of diabetic retinopathy, and controls are age and gender matched non-diabetics were taken as controls. Our exclusion criteria included hypertension and other related systemic disorders, high myopia patients, posterior segment pathologies, previous ocular surgeries, and hazy media. Following obtaining consent and ethical clearance for both cases and controls, standard procedures were performed, including visual assessment, anti-segment examination with slit lamp, fundoscopy, IDO and 90T, spectral domain OCT imaging, and serum HbA1c level estimation. Images with quality score of more than 20 delivers were selected for analysis. CMT and TMV will be measured, with the CMT representing the average macular thickness and TMV the volume of within 1 millimeter of the macular fovea, where macula was divided into 9 quadrants and the volume TMV was calculated. P-value of less than 0.05 was considered statistically significant. Our results showed that 80 patients and 80 study consisted of 80 cases and 80 controls, which are age and gender matched, where it showed that the CMT and the central macular thickness was statistically significant between cases and controls. Similarly, between the total macular volume was also difference was statistically significant. There's a positive strong correlation was found between HbA1c level and central macular thickness, and a positive moderate correlation was found between HbA1c level and total macular volume. Coming to discussion, our study explores the relationship between glycemic control and diabetic retinopathy, emphasizing the role of optical coherence tomography in detecting subclinical diabetic macular edema and glycosylated hemoglobin as a marker for long-term diabetes management. Our study and related research suggested a temporal sequence of ocular changes in diabetes, supporting the importance of early intervention strategies. A study by Gobel et al. Demonstrated the precise measurement of retinal thickness using standard domain OCT, affirming its repeatability. This parallels our study's aim to evaluate macular health in diabetic individuals without overt retinopathy. And the study, influence study, led by Sugimoto et al., supports the reliability of SD-OCT in detecting early retinal damage. It explores OCT's potential for early diagnosis of diabetic alteration in type 2 diabetes patients without retinopathy, aligning with our focus on subclinical changes and emphasizing the importance of proactive diabetic eye care. A study by Lingyung et al. Indicates a positive correlation between chronic HbA1c levels and macular volume, as well as macular thickness in individuals with diabetic mellitus lasting 10 years or more without diabetic macular edema. These results suggest that macular hemodynamic alterations may precede the clinical manifestation of diabetic macular edema. Furthermore, the observed macular changes in these patients are likely attributed to the long-term impact of hyperglycemia. So the conclusion of our studies, our interest suggests that the changes in TMV and CMT may precede obvious symptoms of diabetic retinopathy, indicating a potential link between subclinical macular changes and glycemic control. Our findings underscore the need for early intervention strategies, advocating for a comprehensive approach to diabetic management that recognizes early ocular manifestation as crucial indicator. OCT plays a crucial role in the management of subclinical DME by enhancing early diagnosis, monitoring disease progression, and optimizing treatment approaches to preserve vision and mitigate the impact of diabetic retinopathy. The limitation of the study is a small sample size and the lack of follow-up.